We're pleased to welcome Nadia Hussain, who is a Maternal Justice Campaign Director at MomsRising. Nadia, great to see you.
Great to see you. Thanks for having me.
Tell everyone what MomsRising is as we put up the website.
MomsRising, I call it a movement, not just an organization of over 1 million members who work on advocating for policies that impact moms, children, and families.
You know, there's some stats that are just so alarming. You know them better than anyone. I'll put them out there. In New Jersey alone, Black women are 7 times more likely to die from pregnancy complications than white women. Still, no real progress?
You know, nationally, the rate is Black women dying at 3 to 4 times the rate of white women. That's even including education, economic status. So it's independent of all that. And this is a rate nationally that's gone unchanged for decades, since at least the 20s. And in New Jersey, it's actually worse than even the national average.
Okay, so you're going to see our team's going to put up the confronting racism graphic, because this is about institutional racism, racial disparities on so many levels, social determinants of health, et cetera. How about this one? On average, 47 women die for every 100,000 live births in New Jersey, compared to 20 women nationally.
New Jersey women, unfortunately, die at 2 times the rate of women nationally. And we do have a national crisis around maternal health. So
the obvious question, Nadia, is, I'm not sure there's not one reason. What are some of the main reasons for this?
I'll be honest, one of the biggest reasons is access to health care. It's estimated that 60% of maternal deaths could be avoided with better health care access. That's preventable. There's no reason.
Wait a minute, hold on. I can't let you just get past that. 60% of maternal deaths preventable? How?
Access to health care. Our healthcare system in this country, as we know, is broken. Now there's been obviously movement to improve it. The ACA has helped, the Affordable Care Act.
The Affordable Care Act, right?
Yes. Expanding Medicaid. When the Affordable Care Act, one of the main things it did was expand Medicaid, ensure that if you're given birth before, that wasn't a pre-existing condition, which is ridiculous. But expanding Medicaid helped save so many people who give birth. But as we know, it wasn't mandated that everybody do this. So many states haven't expanded Medicaid. Another thing with expanding Medicaid, which is one of the things that MomsRising and many other organizations are working on, is that so many women actually die as soon as Medicaid ends. So in many states, within that 2-month period when Medicaid ends, you see an increase in maternal death. So actually increasing Medicaid access to not just when you gave birth, but a year after birth, that postpartum period, is really crucial to impacting these numbers.
Let me ask you this, because so much of our work as broadcasters focuses on public policy, less politics and elections, but that matters because it influences, elections matter, and public policies impact it. So here's my question. How much of what we're talking about, from your perspective at MomsRising, is addressed by federal public policy around these issues versus state, or is it a combination of both?
I will be honest, I think both are I know that both are equally as important. In the federal level, in 2018, we are actually able to pass something called the Preventing Maternal Deaths Act. That was kind of the first really big piece of legislation to even begin addressing this issue. And what that did was just open up some research and data, because the issue was, in over 10 years, we didn't even have accurate data of what was happening to women. How do you even address the issue or even work on these policies without that data? So that's what that did. And that was the first step, because you mentioned the racial disparities. Right now in Congress, about a year ago, with this blue wave that happened, again, not making this political, but just being honest, a lot of women entered Congress, a lot of mothers entered Congress, and the Black Maternal Health Caucus was established. And that caucus, one of the reasons it was established was the leadership of Black women-led organizations like Black Mamas Matter Alliance, who had the lived experience to really inform this.
Right.
That organization, that caucus started something called the
Congressional Caucus?
Congressional Caucus. It's literally called, it's called the Black Maternal Health Caucus. It's actually a caucus around Black maternal health. And they established something called the Black Maternal Health Momnibus, which is a Momnibus bill. It's an omnibus, meaning it's a bunch of bills, but it's called the Momnibus because it has a packet of bills that will really be addressing these disparities we're seeing on that national level. And it does that by actually giving money to a lot of the states to implement some of these policies.
But Nadia, I want to be clear, because we're doing this at the end of 2020. There'll be a new president, Joe Biden, on the 20th of January. This will be seen after. you're saying that there was bipartisan support for this in Congress and it was supported by the Trump White House at the time?
Yes, President Trump signed the Preventing Maternal Deaths Act into law. And I will give so much credit to the organizations on the ground, the organizations on the Hill, including MomsRising, that really, one of the things MomsRising does is we share our stories, right? We have members in every single state. So it was bipartisan. We reached out to Republican and Democratic members of Congress to let them know what was happening in their districts. And you won't believe, and maybe you will believe, how many members of Congress have personally felt impacted by maternal deaths. Actually, the lead co-sponsor of the bill, the Preventing Maternal Deaths Act, was a Republican woman out of Washington State, a Republican member of Congress.
And by the way, it's interesting. This is not political, but in fact, it is a fact that of the women who were elected, of the Republicans who were elected to the House in the 2020 election, a disproportionate number of them are women. Is that reason to be more hopeful in this regard?
I think what women are able to do, and studies have shown this, is we're actually more likely to reach across the aisle, be more bipartisan, come up with more solutions, introduce more groundbreaking pieces of legislation, because regardless of political party, many of us as either mothers or women or just, we have lived experience and we know what other mothers and women go through.
30 seconds left. Impact of COVID on this initiative, on these issues?
COVID has been devastating, as you can imagine. The racial disparities have only gotten worse. A new report just came out showing that comorbidities with pregnant women getting COVID, her death rate goes up, and that also falls along racial lines. There's a lot of work to be done. When the pandemic hit, people were not able to bring in their doulas into their rooms, and so that's been another problem. Another thing I will say really quickly is the reproductive justice access to maternal health. That together is another way to improve all of this.
Nadia, we learned a lot from having you, and I assure you we'll have you again, you and your colleagues at MomsRising. Nadia Hussain, I want to thank you so much for joining us.
Thank you so much.
You got it. I'm Steve Adubato. Thank you so much for joining us, and we'll see you next time.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Robert Wood Johnson Foundation, PSC&G, the New Jersey Economic Development Authority, New Jersey Sharing Network, Rutgers University, Newark, the Healthcare Foundation of New Jersey, the Turrell Fund, supporting Reimagine Childcare, MD Advantage Insurance Company, and by Johnson & Johnson. Promotional support provided by AM 970 The Answer, and by the New Jersey Business and Industry Association.
Choosing a new family doctor can be confusing. Check with your health insurer to see which physicians near you participate with your plan. Find out which hospitals the doctor uses and who covers when the doctor is away. And remember to schedule an appointment with your new doctor in advance to fill out any paperwork without the added stress of being sick.